Hello and welcome to episode 5 of What the Health, the Everyday Person's Guide to the Patient Protection and Affordable Care Act. Today we're covering Title I, Subtitle B, Section 1102, also known as Reinsurance for Early Retirees. During the recession, the U.S. saw a trend of more workers choosing to take early retirement rather than be laid off when their company was forced to cut jobs. While this saved the employees from losing all of their benefits, it left quite a few without adequate health insurance coverage. Section 1102 is designed to get those people back on health insurance plans and to keep them covered until January 1st of 2014. Section 1102 lays out a temporary insurance plan for early retirees. On the surface, it doesn't look too different from the high-risk insurance pool we talked about in episode 4. Both plans went into effect 90 days after the passing of the PPACA. Both will remain in effect until January 1st of 2014, and both had a significant amount of money set aside to cover their costs. The big difference here is that rather than offer insurance coverage, like the high-risk insurance pool, this section just creates a reimbursement process for existing plans. The early retirees will have to be on their former employer's insurance plan, but now those plans can apply to the government to have part of their cost reimbursed. Now, subsection A starts with some much needed definitions. First off, an early retiree. This is a person who is 55 years or older, but not eligible for Social Security. Now, Social Security starts at age 65 or in the presence of a documented disability. An employment-based plan is a group health benefit plan that's offered by an employer or by a group appointed by that employer and that offers health benefits to early retirees. Finally, health benefits are defined as any medical, surgical, hospital care, prescription drug, or any other service that should be covered by insurance according to the Secretary. In order to qualify for this program, an employment-based insurance plan must apply to the Secretary for approval and meet 2 conditions. First, the plans must cover everyone regardless of their risks. And second, they must provide accurate information on the actual costs. Essentially, no patient dumping or exaggerating the amount of money spent on medical claims. Subsection C lays out how an employment-based plan can get their reimbursements. Once again, there are 2 qualifications. First, an insurance company must submit a claim with their actual cost per year, including any co-pays, co-insurance, deductibles, or other out-of-pocket costs paid by their members. Second, the claim must be between $15,000 and $90,000. Although there is a clause in here that allows for that upper limit to be adjusted based on the current cost of medical care. If the Secretary approves the claim, then the insurance company can expect 80% of their costs back. Now, that money doesn't come without some strings. The money has to be used to lower costs for the plan members, also known as the early retirees. The money can go towards lowering their premiums, their co-pays, their deductibles, or even reimbursing them for out-of-pocket expenses. The money cannot be used as general income for the insurance company. In fact, subsection D outlines a yearly audit process to ensure that such fraud is not occurring. As with every other section, there's an appeals process. If an employment-based insurance plan applies to the Secretary for this program and is denied, they can appeal that decision. There's also a clause that lets the Secretary stop taking applications for the program if the money runs out. Speaking of the money, there's a lot of that here. Another $5 billion has been earmarked to cover the costs of this program. Just like with the high-risk insurance pool, however, this $5 billion expires with the program on January 1st, 2014. This section may seem like it's mainly for the benefits of insurance companies. However, there's some benefits in here for individuals, too. By establishing a reimbursement process for these insurance plans, it increases the likelihood that those plans will want to cover early retirees. After all, insurance companies, like most other businesses, tend to do what it takes to get extra money coming in. Also, with a limit of $90,000 per year per plan in reimbursements and a total pot of $5 billion, there's a lot of room for a lot of insurance companies to take part in this program. That wraps it up for this episode. One final note, in episode 3, we talked about exchanges. These health insurance marketplaces are supposed to be in place by January 1st of 2014. Originally, the deadline to apply to the Secretary to create such a program was January 1st of 2013. However, on January 24th of this year, the Secretary announced that she was extending the deadline to February 15th of 2013. This gives states and other agencies an extra month and a half to apply to create their own exchange. The Secretary also announced $1.5 billion in new grants to 11 states in order to help them build their new exchange programs. You can read more about that on the blog. This announcement means that our running total is now $11.8 billion for the cost of the PPACA. Next week we'll cover section 1103, which lays out ways that we can all find information on affordable health insurance plans. You know, as opposed to just Googling it. Stay healthy and we'll see you next week.